Okay, so for this scenario, I have chosen the one where I accidentally leave the hot packs on my patient for about 30 minutes or a little bit longer than that. So when I come back in, I take the hot packs off, and they were on their TL junction and then down to their sacrum, and the skin is red and it is starting to blister, so that leads me to believe that there's a second-degree burn. My patient is in severe pain. So I am just going to check the rest of the back. I just want to make sure that there's no other areas that were affected by this. When I took those hot packs off, I want to make sure that I remove them from the area just so that no one else gets burned by them. I've put them back in the little heating tank where they belong. And what I'm going to do next is I just want to ask my patient, do you have any pre-existing conditions, anything else that potentially if it were infected, it would be affected by this? So my patient says no, and then I know that they are not older than 35 or older than 55, and I know that they're not younger than 5. So that helps it be just a little less serious. So what I want to do, which I don't have on me right now, but I'm just going to talk through it, is I would want to put gloves on for this next portion. And as I've assessed the back, I have noticed that it's about 9% body surface area. I already said that it was second degree because of the blistering. So what I want to do is I want to put something cold on it first. Because it's her back and I can't really run water over it, I have some cold packs. So I'm going to use a cold compress. I'm going to grab that and I'm going to place it over the area that was affected. The next thing I want to do is I can offer them ibuprofen just to relieve the pain for a little bit so it's not as painful. And then I am going to offer my patient water to make sure that they're staying hydrated, which is very important. So then because I have my gloves on, I can apply some antibacterial ointment. We're just trying to avoid an infection at this point. So I would go ahead and put it on the back, and then I would have some larger non-stick gauze pads, which I would go ahead and I would place over the areas that were burned. And then what I would do is I would take something soft like pre-wrap, and I would wrap the gauze pads on there to ensure that they're staying. And then what I want to go ahead and do next is I'm going to call 911 just because it's a little bit of a larger second degree burn. And I just want to make sure we're not risking any infection by any of the blisters that have happened. And then if there needs to be more wound care, if the dressings need to be replaced for a certain amount of time, I want to make sure that the patient knows how to do all of that. And yeah, calling 911 would be my last step just to make sure that there's that extra care.